Just as COVID-19's Omicron variant surges in Western Washington, there will soon be fewer testing options available to the public. Today, the University of Washington School of Medicine announced its decision to limit those options.
Yeah, Fox 13 News reporter Frankie Thompson has more from local health officials on this decision and suggestions from the state.
Lines are growing longer and patience is getting thinner as people spend lots of time waiting to take a COVID-19 test at sites across Western Washington.
So it's important to go back to remind ourselves that, this isn't really an inconvenience. This is a serious public health problem right now.
Dr. Jeffrey Baird with the University of Washington School of Medicine says the highly contagious Omicron variant is causing positive test rates to soar. The latest numbers from Public Health Seattle and King County show this site alone in Auburn has a 49% positivity rate,
which is just astronomically high compared to where we have been. In between surges, we have oftentimes seen sites across Seattle at 5 to 10% positive. And at previous peaks, we have seen positive rates of 20 to 25%.
He says those high numbers are outpacing their laboratory's testing capacity. So starting January 4th, all testing sites operated by UW will be reduced to only people experiencing symptoms or may have been exposed to COVID.
We have been targeting a 24-hour turnaround time or less and hitting that goal for most of COVID, actually. But in the last few days, we've gotten to the point where our turnaround times have sometimes exceeded 2 days. And medically speaking, a COVID test that is not back for several days, it just isn't terribly meaningful because someone could go on and spread the virus.
The limited capacity also means UW will have to close 3 of its testing sites, including this one in Ballard. Though there are other agencies offering COVID testing, the Washington State Department of Health is encouraging people to try to find at-home tests, even though those have been difficult to come by.
Especially if they're testing for travel or gatherings, and there's not a particular type of test required for their destination, that they really avail themselves to at-home tests, so that those community-based sites and healthcare system sites that are really focused on diagnostic testing, so people with symptoms or people who are close contacts, can prioritize those patients.
The White House says it will mail 500 million at-home tests to the public in January. DOH says it's working with the federal government to see how many of those tests will come to Washington.
We are also looking at avenues as a state to provide direct-to-consumer access to at-home tests through ordering systems, as well as for people who have low incomes or who may not be tech savvy, through community-based organizations and local public health.
Frankie Thompson, Fox 13 News.